what you are seeing is a right lung. It has got an apex which is directed above, a base which is directed below, which is called as inferior surface of the lung. This is the costal surface of the lung, and this is the medial surface of the lung. So the anterior border will be sharp, the posterior border will be rounded. The surface which contains the hilum of the lung should be facing medial. The inferior border, which is sharp, should be face, or the base should be below. The apex should be above. The sharp border should be anterior. Rounded border should be posterior, and the surface which has the hilum should face medial. So this is how you identify the side of the lung. So right lung can also be identified by presence of two fissures. One is the oblique fissure, which bisects the lung completely into an upper half and lower half. Another one is a transverse fissure extending from oblique fissure to the anterior margin, dividing the lung into three lobes: an upper lobe, middle lobe and lower lobe. And another important feature is the anterior margin of right lung is straight, unlike left lung, which will have cardiac notch. So apex, base, costal surface, medial surface, anterior margin, inferior margin and posterior border. Apex above, the base below, the sharp border anterior, the rounded border posterior, and the base facing inferior, and the portion containing the hilum or the surface containing the hilum should be facing medial. So this is left lung. Left lung can also be identified by the presence of only one oblique fissure, which divides into an upper lobe and a lower lobe. So this is left lung, and that one which I have shown before is a right lung. Now for the hilum of the lung structures. This is the hilum of the lung. The portion on the surface of the hilum which is penetrated by the bronchi and pulmonary vessels and bronchial vessel is called as hilum. The collection of these structures covered by the pleura is called as the root of the lung. Both are different. So this is the hilum of the lung, and this is pulmonary ligament. So the order of arrangement of hilum of structures in the right lung. This is right lung. First will be eparterial bronchus from above downwards, pulmonary artery, hyparterial bronchus, superior pulmonary vein and inferior pulmonary vein. These small openings are bronchial arteries. Two will be there on the left side, one will be there on the right side, along with lymphatics and nerve plexuses. So eparterial bronchus, pulmonary artery, hyparterial bronchus, superior pulmonary vein, inferior pulmonary vein. From before backwards, pulmonary vein, pulmonary artery and bronchus. That is the order of arrangement from before backwards. Above downwards, on the right lung, eparterial bronchus, pulmonary artery, hyparterial bronchus, superior pulmonary vein and inferior pulmonary vein. When you want to identify the bronchus, you palpate the wall of the opening. If you feel the cartilage, that is bronchus. Or you can compress the lung, you can see fluid coming out with bubbles. So that also shows this is bronchus. And the pulmonary artery is conveying deoxygenated blood. So its wall will be dark in color, whereas pulmonary veins are conveying oxygenated blood. So their walls will be not bluish, whereas pulmonary artery's wall will be bluish in color. Okay. Now we move to the hilum structures on the left side. This is the hilum of the left lung. Here there will be only one bronchus. This is the bronchus. You can identify the bronchus by the fluid coming out when I compress the lung. So from above downwards, pulmonary artery, bronchus, pulmonary vein. From before backwards, superior pulmonary vein, pulmonary artery and bronchus. Besides, there will be two more openings of two bronchial arteries, lymphatics and nerve plexuses. Once again repeat, above downwards, pulmonary artery, bronchus and inferior pulmonary vein. Before backwards, superior pulmonary vein, pulmonary artery and bronchus. This is pulmonary ligament.